Welcome back to another episode of the Boss Juice podcast. With us today, we have Shawn Nairn of ACORx Pharmacy. Shawn, thanks for coming on.
Awesome. I'm glad to be here, man. I'm really excited to talk to you guys today.
Yeah, likewise. So I have to ask, pharmacies, they're everywhere, big business, but I cannot tell you the last time I've seen more of a privately owned pharmacy. So does that make you unique? Are you one of the very few privately owned pharmacies in Pennsylvania?
So, there's a lot of issues with that sort of, with the industry of independent pharmacy. That's what we call it when you're privately owned. And for years, this goes back to your parents, and you guys are even, younger, like your grandparents. There was independent pharmacies on every corner. That's where you went, right? I mean, you got candy there. It was like a mini mart with a pharmacy back then. And over the years, the chains came in and sort of muscled a lot of the little guys out. And recently, the independent pharmacy segment of retail pharmacy has really been under attack and it's not so much the big stores. It's not so much the competition from the CVS's and the Walgreens or the Giant Eagles of the world. It's because of the PBMs. And I'll give you a minute on that because it doesn't really pertain to our conversation today. But a PBM is a pharmacy benefit manager. And so what the big health insurance companies do today is Highmark, for example. So Highmark doesn't really manage any of their prescription business. They sub it out to a PBM. And the one they use, for example, is called Express Scripts. Mm-hmm. So you may have seen, like on your insurance card, you may see their logo. CVS owns one. It's called Caremark. So the middlemen are the people that just manage the pharmacy component of health plans. But unfortunately, the downside of the middleman is there's another layer in there that they're trying to make money, number one, and they're dictating to me what I get paid when I fill a prescription. So when you think about it, prescriptions today, are exorbitantly expensive, at least the newer generation brand names, like the Ozempics of the world that you guys hear about, the Wegovy's that are on TV and on the news and such a big thing. They cost me $1,200 a month. So if you're on insurance and you're getting paid for that, or if you're, up. If you're on insurance, right, and you're paying $50 as a copay for that, somebody's paying me the other $1,150 for that product. And what these PBMs do is they dictate how much the pharmacies get paid for these products. And as crazy as it sounds, there are a lot of scenarios where we actually lose money on filling a prescription because they have their own formulas that they use to establish what they're going to pay me. So again, I fill a prescription for you, you pay $20 because that's your copay. They make up the difference. But a lot of times, again, that difference isn't sufficient to even make me whole. So, and that's why a lot of pharmacies are going out of business. Frankly, now it's finally even caught up to the chains where Rite Aid, who has already gone bankrupt once, is literally any day now supposed to go through bankruptcy again. And I don't know that they're going to even come out. Rumor has it that this will be it. Someone will either buy them, and anything that's not bought will end up being closed.
Wow.
So the PBMs are sort of the bane of independent pharmacy right now because it's very hard for us to survive if you're in a scenario where you're losing money on some of the prescriptions you're filling. Right?
Are there ways around that?
It's not a business model. It's not a real great business model. Mm-hmm. Somebody said, hey, I'm going to put you in business. You're going to lose money on 20% of the prescriptions you fill. You're going to break even on 30% of the prescriptions you fill, and you're only going to make money on 50% of your business. Right. It's not ideal.
Do you think that's done purposefully to kind of weed out smaller businesses from coming into the industry, or
great question. They put up a lot of, they sling a lot of bullshit about how they're looking. Their interest is for their client, which in this case is Highmark or UPMC or something like that. The major insurance carriers are their clients, so they're trying to save them money, right? Or potentially trying to save money for the business that is paying for the prescriptions, like a PPG, company, or US Steel or Ford, they're working on behalf of them to save money. And, they're kind of throwing the little pharmacies under the bus. The problem is, where that's going to hurt is the little pharmacies, are needed because the chain pharmacies just won't go everywhere. Right? They're leaving, nowadays they're leaving like low income cities, like poor neighborhoods. They're leaving there. So, a little guy could go in there and fill that gap real nicely. But if you can't stay in business or can't make enough money, why would they? Right. So, there's a lot of turmoil in pharmacy, nowadays, and there has been for the last couple of years. As important as pharmacy is to the system, there's constantly sort of turmoil in there. And the guys that are surviving today, when you see independent pharmacies out there, and I have a lot of friends, and they're sort of local and in neighborhoods, they're kick-ass operators because they're, they know how to make money and survive. Whereas some of the old school guys, they just wanted to fill prescriptions, and for years they were able to just fill prescriptions and make a living. Today, you have to be a little more sharp. You have to manage your inventory. You have to offer clinical services. You have to do flu shots and vaccines. Like, it's not just fill prescriptions, make money, and that's it.
Sure.
Well, it's not a clip from It's a Wonderful Life either, where the pharmacy is part of the drugstore and soda shop and all this other kind of stuff.
Yeah, that's what I'm saying. Those days are over. Yeah, those days are over.
Completely done. And when you took us on a little tour earlier, which this place is fantastic. Number one, I don't know how many people ever get to see the inside of this place, but the artwork and all these other things, it speaks volumes about the personality behind this business. And it's really cool stuff, but your processes, your procedures, and I think the different things that you've probably seen. So I grew up in the 70s, 80s, 90s, whatever. And I think back at like terms like Medicare and Medicaid and all these things. Do you remember when the whole Tylenol incident caused packaging to change because they tampered with the,
you and I, we don't have any hair. We're a little bit thicker around the middle. Right. This is what we're on the same age, same generation.
All
Shawn.
These things that we've seen, that we've grown up with, and now fast forward, the service and I don't know if you want to call it product that you offer, it's done in a completely different way, in my opinion. This is, this reminds me of one of the cannabis type facilities as far as the size of.
Sign me up for that.
Well, seriously, the size of the facility, the cleanliness, and safety, locked front door, things like that. It's secure building, so it's different. You've got an interesting business here, man, and an interesting story. How did you start seeing a niche or / opportunity for this?
Well, first of all, I certainly appreciate the kind words. Right, we're very
cool
proud
place.
of the. What we've done here, the culture here is very important to me. We've spent a lot of money, had a lot of consultants in here, so I can convey what I want to my people, right? And then hopefully they can then pass that down, as they interact with our patients. But the culture here is very important to me. This Friday we have a food truck Fridays coming up. So we're constantly doing stuff to reward my patients reward my employees, for the work that they do. Pretty much they're all rock stars out there, and I'm proud of them. As far as how did this come about, couple reasons. There's a couple merging pathways that led us down this road. I was in a meeting conference, and they were talking about a new. Are you guys familiar? Like maybe they call your healthcare plan an HMO, right? You're familiar with that lingo, health maintenance organization. There was a point maybe 10 years ago that they were going to come out with HMO 2.0, and what they were calling that was an ACO, an accountable care organization, and the concept was. Whereas traditional healthcare is kind of siloed. You have a doctor, you have, the doctors didn't talk to specialists, that didn't talk to hospitals. So there was nobody really knew. Like even today, like we'll have a patient that's in the hospital. Nobody told the doctor that the patient was in the hospital because everything is siloed in healthcare. If I call a doctor Monday and say, Mrs. Smith just got home from the hospital, do we have some new medications for her? What, she was in the hospital? I didn't know. And that's the way it is. That's the way healthcare operates. So the ACO, Accountable Care Organization, was in theory supposed to be all the moving parts of healthcare under one umbrella. There was going to be shared databases. So the doctor knew that the patient was in the hospital. So the nursing home would tell the doctor that Mrs. Smith is going home today, after her hip rehab, all those things. So that was it. It was an accountable care organization. And all the moving parts of home care too. Let me throw in home care there. Like home care would know when the patient's coming home, and they would have somebody there, sort of ready to greet them and treat them. So that was the ACO. And I was sitting in this conference and said, wow, that sounds very intriguing. But the one thing they didn't mention was pharmacy. They were talking about home care, talking about physicians, talking about specialists, talking about physical therapy, talking about diet stuff, talking about nursing homes, talking about hospitals. They totally left pharmacy out of the conversation. So Shawn in the back immediately started, the wheels are turning, and why they need to get a pharmacy in that mix. So I started ACORx, and I was going to be the pharmacy that played in the HMO 2.0, which was called an ACO. Well, long story short, the ACO never really took off. There actually are some functioning ACOs. UPMC has one. I think Highmark has one. But they don't really work like the original plan was supposed to. So taking that in mind, where the ACO never really took off, we kind of pivoted a little bit and, kind of veered down the road of seniors. Obviously, seniors are a big user of medication. There's a lot of them. So seniors living at home for a lot of reasons aren't in a nursing home. Maybe they can't afford it. Maybe they don't want to go. Right after COVID, nobody who wants to go to a nursing home after COVID scared the crap out of everybody. Everybody dying was in a nursing home. Mm-hmm. So that really never took off. So nobody wanted to be in a nursing home. So we kind of pivoted to saying, let's develop a pharmacy that is more than just a pharmacy, that focuses on keeping people at home. Mm-hmm. As our population ages nowadays, there's just not enough nursing homes, number one. The care and quality of a nursing home, and this is not a result of the operators. I mean, operators are doing the best they can, but like the reimbursements, if you own a nursing home, it goes back to the pharmacy story I told you earlier. Like some of these nursing homes are barely making enough money to cover the expenses they have to treat all these people. So the care there can be a little sketchy. It's expensive. Nobody wants to be in a nursing home, as we already said. So we were like, let's work on treating people at home. There's no doubt that as the population ages, the care for this population is going to move home. Number one, the patient feels better. You're going to get better results, right? If a person is at home and you give them instructions and they're taking their meds and doing their exercises, if they're at home, they're more comfortable. You're just going to get better outcomes. It's less expensive from a health plan side, or like for the government side, like with Medicare, it's less expensive to keep these people at home versus having them in a nursing home. And again, there's a space issue because there's just not enough. We couldn't build nursing homes fast enough to accommodate the aging population. So with all those triggers, like aging at home, aging in place, these are all like terminology that they use for it. But treating people at home is definitely going to be the future. So we said, if we can make and when I say we, I mean my team. I'm just a good-looking guy. They're the smart ones. But if you believe that one, I'll sell you this place too.
I feel the same way about myself, right?
It's hard. It's hard being me. But no, my team is really they're the glue that holds everything together. They're the smart ones. But we pivoted, come up with this packaging that if you can think of a traditional pill case, like a Sunday, Monday, Tuesday, maybe your parents are using them, maybe your grandparents are using them. We worked with another company, and we have a package that is essentially, that, right? A pill case, but it's divided into 28 weekly doses. So 7 days a week, 4 columns of medications. That's breakfast, lunch, dinner, bedtime column. I think I have a package.
Yeah.
Give me that package. It's right over there.
You call that map?
Where is it? Here, it's right here in front of on the windowsill. Can we see that if I put it up there? Can you guys see that? Which one am I using this camera right here? So, this is an example of our packaging, right? So it's customized with the patient's name on it. You can see where it's a breakfast, lunch, dinner, bedtime columns here. And then on the back, it's timestamped to tell you exactly when to take it. Breakfast, lunch, dinner, bedtime. So if you're interested in taking your medication accurately, this is a foolproof system. Now, granted, there's some people that just have, could care less about it and aren't going to take medications no matter, no matter what you tell them or matter how much you impress upon them how important it is. But if you do have an interest in managing your medications, if you're a senior, maybe a little bit, you have some senior moments. Did I take my medications? Did I not? I'm not even a senior yet, and I don't even remember if I took my medications or not. So this is this pathway allows you to organize your medications to get you the right dose at the right time.
And ultimately keeps people safe.
That's right. That's right. I mean, could you imagine what happens in a lot of these scenarios? We were talking about a pill case. Well, grandma's filling grandpap's pill case or vice versa, and grandma's putting her pills in grandpap's case and putting 2 pills in this one and not one in the Wednesday bucket. So, yeah, I mean, this is all checked by pharmacists. It's done by technicians, checked by pharmacists, and then hand delivered to people's houses.
Customized. The packaging's easy to read. You made it convenient for people to open these, everything.
I mean, a big problem with pharmacy for many years, right, is the difficulty opening caps for people. As you get elderly, a little bit of arthritis sets in, you can't open your caps. There's no opening caps here, right? So could you imagine having to open 10 bottles? Mm-hmm. And then this one is once a day. This one you have to take twice a day. I mean, it's really, it is a difficult regimen to organize.
Well, my mom lives in Charleston, South Carolina. I can't be there every day.
Sure.
Say I'm visiting and something happens. I don't even know where to pick up. So this would be
perfect. She's a perfect candidate,
nice.
Right? Yeah,
exactly.
It's a perfect candidate.
You guys call this MAPS, correct? That's the
we do. We use the term MAPS, medication adherence packaging. Mm-hmm. So it's a nice acronym to fold into marketing pieces because we'll market it like if you're lost with your medications, follow our map.
Right.
So, there's some convenient tie-ins there.
That's super cool. So kind of going backwards a bit. So if my research serves me correctly, you were already in the pharmacy industry and then you kind of pivot over to start your own business. What was that like? And what is the startup cost associated with that? Because I feel like, if you start a shop or a clothing store, there's costs associated to have that inventory, but medication is a completely different world. How do you start this business? Did you have to get investors, take out a loan? You self-fund this? How did you pivot into this?
Yeah. Business? Let's go back a little bit. Let me give you a couple minutes when I truly started when just out of school and everything. Let me give you that history, and then we'll discuss a little bit what it takes to get ACORx started, or the tossing and turning at night of should I do this or should I not? Is this worth the risk? Am I going to go broke? Is this something I want to bite off or not? So I grew up in Ford City, PA. It's north of Pittsburgh. My father's best friend was the pharmacist in town, Kling & Smith's drugstore. They're still there today. There's actually they have a half a dozen of them. Yeah. So that was my pharmacist's best friend. My dad's best friend was the pharmacist in town. So when we grew up, right, this guy was him and my dad were best friends. We'd go golfing. He'd pay for me to golf. We'd go over to their house. He had the swimming pool. He had the nice cars. He and my dad would go to the bar at happy hour, and he'd give me a roll of quarters to go play video games. So this guy was I was like, man, I want to be a pharmacist too. So literally my whole sort of, adolescent, teenage, college age career, I just knew that was why I always wanted to be a pharmacist. And then I thought a little bit, I was reasonably smart in high school, but, I didn't want to be a doctor. That's a lot of school. I didn't want to be a lawyer. That was a lot of school. So pharmacist was perfect. When I went to pharmacy school, it was a 5-year program. Now today it's 6, but that's a different story for another podcast. But so I ended up going to pharmacy school, and did okay, got out. I worked for Thrift Drug at the time. So Thrift Drug was a drug chain around here, kind of like Rite Aid or CVS. Thrift Drug has since been absorbed by other companies, but that's where I started and cut my teeth. And I fucking hated it. I mean, it was the worst job. I got out there, I was ready to save the world. I was going to help all these people. And all you do is stand behind the counter with your head down, counting pills as fast as you can. And you're not allowed to look at anybody or talk to anybody or even go to the bathroom because you have to do them as fast as you can because people are standing there waiting, giving you the stink eye. So it was like, boy, this isn't really practicing the profession that I thought it was. So I left Thrift Drug and I went to CVS because they were not really in Pittsburgh yet. So they were kind of new and they weren't like the stores weren't quite as busy as the Thrift Drug was. You know, they were just kind of cutting their teeth and people didn't have a trust in them yet and they were trying to build their brand. Today, they're the biggest pharmacy chain out there. But you know, in that day, this was in the mid 90s, they really weren't, didn't have a mark in Pittsburgh. So I went there to work, but it was just more of the same. Fill the prescription as fast as you can. Don't talk to anybody. Don't go to the bathroom. You know, work 9 to 9. You know, work Saturdays, work Sundays. I was like, man, this really stinks. So then I decided that I would open my own store. So I went to my mom. Mom, I want to open my own store. She says, well, I don't have any fucking money. I don't know how you're going to do that. And she says, why don't you go talk to Joe, your dad's friend from Ford City? Just find out if it's even worthwhile to do. So remember, I told you when we left, the guy had the pharmacy in town. So I said, that's great. I called Joe up, super nice guy. He said, come on up. I'll tell you how it all works. And I said, hey, man, great. Make an appointment. We go up there. I go up there for lunch. So meantime, this guy who had one pharmacy at the time, now he has like 6 pharmacies. He has a home health care company. He has a pharmacy that specializes in nursing homes, servicing nursing homes. So he had built this big conglomerate, over the years that we weren't really in touch with them. So very impressive. So we start talking about opening a pharmacy and, he says it's hard work and you got to be willing to do it. And I said, he said, it's not all you're cracked up to be, right? And he told me, here's the story he told me. He said, listen, you buy a tube of toothpaste and you put it on your shelf. He said, it costs you $1. He says, you sell it, you make $2. He said, the only problem is you didn't make $2 because you have to buy another tube of toothpaste to put it back on the shelf to sell it again. So you didn't make $2. You made $1. So that was the great, that was the funny story that he was emphasizing, that it's not that easy. But so at the same time, let me just throw in, there was a point in there, my father passed away, young guy, 39, passed away, heart attack. So he says, oh, but I loved your dad. He said, if you want to buy your store, if you want to open a store, he says, I'll tell you what I'll do. You buy the store, do all the work. I'll give you the money and we'll be partners. Well, I mean, who's passing that up, right? I have nothing. I didn't know, my father passed away when I was young. My mom, we didn't have that kind of money. I had brothers, just don't have the kind of cash to go buy a pharmacy. So, of course, I took him up on the deal. And, arguably the rest is history. We eventually did that deal. He and I owned some stores and we owned some other stores together. Then eventually I was able to make enough money to pay him back and buy him out. And, then I started to fly on my own. But I would have never been able to do it without Joe Sipple.
Incredible story.
It's a great story. In fact, I hope to do it for somebody else. That's the one. Same family. You had same family, same business. Yeah, same family, same business. Yeah, that was my connection to pharmacy.
Through your dad, what a cool way to really get more than get your feet wet. I would have still been toiling away. I would have been at like a CVS or a Walgreens or something like that, even today, if he didn't help me out. So someday I hope to do that for somebody else.
Yeah, absolutely.
So, not Jaden, because I don't trust him.
No one does.
But I will do it for somebody else because I think that's, I owe it to somebody.
It's funny that you say that because we've had multiple guests and even, like entrepreneurs that I take to lunch and ask questions. They always tell me pay it forward. They're like someone in their life helped them or mentored them to get them to where they are today. So it's always pay it forward. And so it's interesting to hear that, you had this sort of mentor. Is he still alive? Is he still?
He is not. He is not. He passed away. In fact, in May is the first annual golf outing in honor of him. So I'll certainly be there and certainly, participate.
Did you start?
I did not. His family did.
Great idea.
His family is still involved in the store, and there's dozens of them. They're having babies left and right up there. My good friend David, who was his son. David and I are still friends. He just had a grandchild, and so they have there's plenty of family members to take over the empire up there. They don't need me, so I'll try to build my own down here.
What's one of the biggest lessons you learned from him as a mentor?
The hard work capacity. I mean, again, he mentioned, I mentioned the story about how, he would tell me a story like, almost trying to scare you out of it to really test your mettle and find out, this is what you're getting into here. I know him with the nice cars and the swimming pool and the money. I didn't know him when he was cutting his teeth and trying to figure it out. But, success, there's no better way to strive for success than hard work. Right. I don't know, generically speaking from 99% of the time, if you work hard, you can be a success. So when, my first store, when I owned a store, the store I talked about that he and I bought together, I literally worked 364 days the very first year that I was open, because the guy that I bought the store from was an old timer, and those old timers back in the day, they would just open every day. Like that was just the lifestyle that they led. Mm-hmm. The holidays, they were like, hey, medicine. They felt like the community needed them. And again, in the old days, they kind of did. Now there's hospitals that are open and chain pharmacies and so on. But so they had that mentality. So when I bought him, I was afraid not to be open because I didn't know what his people expected.
Right.
So the first year, I literally worked 364 days. My wife said she'll kick me in the balls if I don't close for Christmas. So, we closed for Christmas Day. And, of course, nobody called. Nobody even bothered me. So then the next year, I closed on Sundays. Nobody really cared. And everybody stayed with me and supported me. And then I went from 9 o'clock to like 7 o'clock, and nobody cared. Everybody stayed with me. So I learned a lot in that capacity too, right? If you provide a good service and you're good to people and honest and, like I said, you're a quality person. People will come to you regardless. They'll stay with you. They'll bend a little bit within reason, to accommodate you, but they want to stay with you because you're doing good for them, and they'll in turn support you.
Man, what a great kind of journey you've had. That's a crazy word, but think about it. You've experienced startup. You've experienced taking over something that was already established and changing the culture and the whole probably processes, and without trying to forfeit the customer base that you were serving with that business that you bought. There's so many different things that that are part of your fabric that I think a lot of people don't get to see. Think about it. You started, you worked for somebody else, you bought your own business that was pre-established. You started a business, I'm assuming with ACORx, that wasn't here before you, Kind of a cool thing. You've got a lot of layers, man. You really do. Good information to share with people too.
I don't know if I'm super deep, but I think I am.
Yeah.
You know what I mean?
Yeah.
It makes me feel good to think I am. And listen, let's be honest. So let's go back to your success talk. Like hard work is important. I think a key component of why ACORx is successful is because I solved a problem. How do we help these people stay at home longer that can't afford a nursing home, don't want to go to a nursing home, don't live near one, maybe don't have a family member to help them navigate the complexities of a healthcare system. It's very complicated. Like, man, knowing what insurance you have and how to navigate, it's hard nowadays. It's very complex. And so these people that don't have family members or support in that capacity, to be that for them solves a problem. So one aspect of being an entrepreneur is, if you solve somebody's problem, you probably have a business.
Sure.
Right? So what do I have? We talked about this, before we went on air, but, my population here, the population that is elderly, low income, low healthcare literacy, probably should be in a nursing home, isn't. What problems do they have? They're the biggest problem for an insurance plan. So basically, I solve two people's problems. I'm solving the person who lives at home, my patient's problems. I'm also helping the healthcare plan solve their problems because they can't treat that population either. This population, cell phones aren't always on. That they don't answer calls from 800 numbers because they're, they don't know who they are. It might be a bill collector and they don't want to hear it. So they're not answering the calls when the health plan calls to say, hey, you need your colonoscopies up, or you need a breast cancer screening. But guess whose calls they do take? Mine. Because they trust me and they know I'm bringing their medicine, and, they that's the vibe. We give off the vibe that we have their best interest at heart, right? They know that they need their medicine. Is it a complex, is it a lot of medicines? Yeah. but they know, and then they trust me. And not just me in our model, but all independent pharmacies, right? The people are in those independent pharmacies all day long, buying their lottery tickets, buying their cigarettes, maybe good or bad, they're buying their cigarettes, but they're in that independent pharmacy. I have access to them. If you ask a health plan what some of their, with that population specifically, what their biggest problem is, it's accessibility. They don't know where those people are. They move and don't tell the, they don't, when they move, those people aren't thinking about telling UPMC. They're more worried about what kind of place am I getting? Does the heat work? Does the air conditioning work? Can I walk to a grocery store so I have food to eat? Like, these are issues, these are real-time issues that people face in society that maybe some of us don't, or granted, no doubt some of us don't. But, to solve that problem, you just build on it. And then that's how ACORx came about. We now have opportunities where we do a bunch of clinical services for Highmark and UPMC. We counsel patients on diabetic patients, and they pay us for it. We counsel asthmatics, people with COPD, breathing issues. We counsel them, and they pay us for it, right? So, again, we're solving problems, and we're building, the ACORx brand around solving those problems.
That's interesting too, because just kind of before this episode, I was looking into pharmacies and the independent pharmacies and all that stuff. But when pharmacies first came to be, it was more so like that, where it's like you came in to kind of figure out, I'm having this issue, what can I do to help myself? And they were kind of more like, care providers, where then it sort of pivoted into this like...
You're right. Back in the day, they would go... The pharmacy was like the cornerstone of the community.
Correct.
Right? I mean, you would send your kids down with a note of stuff to get. Right? Now, today, if a 10-year-old kid walked into a pharmacy and said, get my mom some cough medicine and this, the guy's going to be like, I'm not giving you this, pal. I mean, I don't know what you're doing with it. Yeah. But back then, the mom would just write the note of the grocery store list. The kid would go to the pharmacy and somebody would get all their stuff for him. Put it on a tab. The kid wouldn't even have to pay. They'd put it on the family tab, and the kid would go back to the store. Maybe the pharmacist would give him a lollipop on the way back. That's the way it was.
Yeah.
And there's nothing wrong with that. And to some extent, it would be nice if it went back to that. I'll tell you, there's a massive gap in the number, as we talked about people getting older, there's a massive gap in the number of primary care physicians that are out on the market. This is why if you try to call your doctor, you might be looking at 6 weeks before you even get in for an appointment. Well, I'm sick today. Mm-hmm. And that's why the Med Expresses of the world and the urgent care centers have all found a niche, right? They're solving a problem. You're sick, but you can't see your doctor. So where do you go? You go there. They've solved that problem. But from a healthcare perspective, it gets very expensive to start relying on those people. Or worse yet, people go to the emergency room. That's horrible. That's the most expensive, and like some of my population, the emergency room is their doctor because that's all they go to. It's all they know. It's all they have access to. So, there's just a lot of moving parts in healthcare is what I'm trying to say. Ultimately, it'd be great. I'm going to cut you off. Yep. One more thing I would like to say is if they would get to a point where they would allow pharmacists to prescribe medications. Now, I'm not saying everything, but there's no reason that if you come into my pharmacy and you're sick that I can't prescribe you a Z-Pak.
Right.
What do you have to go to your doctor for? Pay him a $25 copay. And then come to my pharmacy and then wait for 2 hours while I fill your prescription. And then you have to pay $10 or $15 for your copay for the Z-Pak. Just come to me and let me give you, just the basic stuff, antibiotics. If you have poison ivy, I can give you some creams or lotions that would work for that. Like, that would ease the burden and save the physicians for the more important stuff.
Yeah, no, that's a great lead-in, because the question I was going to ask is, when I spent about a month in Europe, and Italy specifically was great at having like a pharmacy almost on every corner. And I had one day gotten this really bad heat rash, and I was like, okay, like, I don't know what to get, what to use. I walked in, and like there was a pharmacist there who looked at it, like, yeah, it's a heat rash, and like, here's, asking me some questions, here's this, you look at it, it was not in America. What I was given was not an off the shelf product,
Right. It was a prescription style level, prescription caliber product.
Correct.
Sure.
Now, think about it here. I would have to go to the doctor, say, I have had this heat rash, they're going to prescribe. I have to go now to the pharmacy, this and that. It's like, walk down the street, is like, I have this. They're like, yeah, here you go.
Yeah. And I don't know that we'll get there, but I mean, it would be nice if we did. Again, it solves a lot of problems because there's not enough. And again, this aging population, the system's going to ultimately collapse on itself if something doesn't change. Everybody's getting old. Healthcare is so expensive. Drugs are so expensive. Treatments are so expensive. I mean, it's going to implode on itself because there's not enough money. I mean, you guys, if you buy your own insurance or if, through your company, it's expensive. It's ridiculously expensive because everything is expensive in healthcare. I'm not saying, I don't know how you make it less expensive. The problem is, do you take a path where you try to keep people healthy versus be proactive? Try to keep people healthy versus reactive, where you wait for them to be sick and then you treat them.
Right.
Is there money? That's expensive too. So I'm not saying that's, I don't really have a solution. I really don't. I think, it's got to be a combination of probably everything. Sure. One thing that I think needs to happen is people need to become more accountable for their own health care, right? This is why I think everybody should have a high deductible, because then you're more aware of the money that you're spending because it's yours. So if you need an x-ray, you might look at St. Clair Hospital and you might look at Med Express and you might Mercy Hospital. You might look at 5 different places to see who has the best price on the x-ray, because it's your money you're spending. So then it becomes up to them. If they want to be competitive, they have to watch their prices.
Sure.
It's kind of like health insurance is kind of like and this is not my analogy. This is my friend Kyle, so I'll share it. But it is Kyle, so props to Kyle. But health insurance should be like auto insurance. If we have an auto insurance, if we wreck our car, we determine how much it is, whether we want to pay for it ourselves or turn it into insurance, right? Because if it's a ding and it might be $100, you may just opt to pay for it yourself versus turning it into insurance, because now you're afraid that $100 insurance claim is going to raise your insurance $200 or $300 next year. So maybe health insurance should be the same concept. You only use, we only pay for, we pay for a lot of the low end stuff and save the health insurance for the high end stuff.
Correct.
How do you, so you build a brand, you build an identity, you got the color palette and all this other kind of stuff. It's about reach. And you said earlier too, that people trust the organization.
Yeah, they do.
And you're building that thing. So are there other ACORs out there in other areas doing what you do? The thing is, I just listening to your story, your background and everything like that, you're a dot connector in a specialized industry because it has to do with people. It has to do with products. It has to do with service and distribution and compliance and all these other things that you've had to do. But I feel like you've taken these a bunch of steps forward. And we talked earlier before we got on here about the service area that you have. You service the Pittsburgh area, Western Pennsylvania.
Western PA,
right?
yeah.
Right. So, what are the things that you think that you guys did really well to build that trust in this name? And what do you think about, you said there's opportunity. You should be servicing more people in this region because it's an aging population. It is. There's a lot of opportunity. And I don't even mean that you're capitalizing in a bad way. You're helping people, but how did you get this trust built?
Well, I think that, traditionally a pharmacist, again, we talked about their value in the community and all. So the population that we're treating today, they come from that generation. They grew up when the pharmacist was the hub of the community, where that little store on the corner was, where they went. The kid might stop there on his way home from school and get some penny candy, and the mom was going there to get their cough medicine and their Band-Aids and their prescription medications as they came about. But our trust is based in listening to our patients. We still answer our phones ourselves. We certainly have some technologies from a phone service, but ultimately we try to answer as many calls ourselves as we can, because that generation, more than anybody, the guys in this room may not care if we have to listen to an automated voicemail. Those people, they struggle with it. It's complicated. So we position, we strive to answer all our calls ourselves, right? So we listen to our patients, right? We meet their needs. We will go above and beyond. My delivery drivers are excellent. My delivery drivers take people's garbage out because a little old lady and it's raining or it might be snowing in January and they drop off their medication. They'll take our garbage out, or they'll open a jar of pickles for them. Something as simple as that. But more importantly, my delivery drivers will come back and say, boy, I was at, Mrs. Jones's house today, and her she didn't look good. Well, we'll take that and we'll call the son or the daughter or maybe a home care nurse and say, hey, we were there today. We had eyes on the patient. This is why I use delivery drivers versus a mail order model. Now I have, you like that? Now I have eyes on the patient, right? So that's valuable. So it's our service that they like. And again, we pride ourselves here in our culture. But, everything I tell my people, it always ends when we train. It always ends with, but be nice.
Sure. Well,
tell them this, but be nice.
One of the things too with this is that audience that you're serving grew up in a certain society, the way society was at one time, with certain expectations. And I think that group that you're discussing, I think that was even before there were Med Expresses in places like that. So now, a little bit younger generation, we've come to expect that there's convenience out there. There are things like that. Like, I'm in a fortunate position where, honestly, my family doctor still will call me at night sometimes to check on me, which is unusual. When I grew up, big Italian family, we had a family doctor. Those things just really don't exist that way anymore. So the things that you're doing, they're progressive, and this audience is younger, but it's aging. Their expectations are going to be different. That's where I think you're ahead of the ball game here in the way that you're operating this place.
For sure.
I think we are. And again, we're proud of that. I mean, eventually people will do what we do. We're ahead of the curve. It's my job as the leader of the ship to stay ahead of the curve, right? To not be complacent, to, constantly be aware. I mean, my team, if I frustrate my team at all, it's because I keep throwing the proverbial mud against the wall to see what sticks. Mm-hmm. Can we add this? Can we add that? How do we get people... How do we figure out, how do I get somebody a flu shot at home? I can't really send a pharmacist out to all these places because a pharmacist makes too much money. But so I can't really have a pharmacist as a delivery driver. Mm-hmm. But are there pathways that we can, for example, get to somebody who's at home, get them a flu shot in the fall that might not get it, right? And so we go to the health plans and say, hey man, I have enough reach to get to some of these people, but if you want them to get a flu shot, you got to help me out a little bit. You got to give me a little delivery fee or something like that to compensate, because I just can't send a high-level employee, a pharmacist, there. But some of them were okay with that because they want these people to have their flu shots. Or nothing really revolutionized pharmacist value more than COVID. Right? I mean, COVID really put pharmacists on the map. Without pharmacists, we'd probably still be in COVID because of the accessibility of a pharmacist. There's a pharmacy on every corner, and you could get a COVID shot in every pharmacy. I mean, if you just counted on doctors, for example, they'd probably still be giving people COVID shots just because there's not enough of them. So pharmacy really flexed their muscle and proved their point in COVID. And hopefully, there's still a lot of remnants of COVID around, but hopefully as we come out of COVID, pharmacy as an industry will be able to, take those props that they earned and build it into some other things. Sure. We're thankful here at ACORx that, again, we're constantly trying to reinvent. I want to stay ahead. It's my job as the leader. It's my job as an entrepreneur to stay ahead of the game. What is next? What do I need to add? What my new thing is? Like, I'm constantly looking at technologies. I think if there are technologies that we can marry with what we do, it makes us sort of sexier in the eyes of the healthcare industry. Pharmacy's kind of blue collar, right? You're putting pills, you're taking medications. It's not real sexy. Right. It's not anything new. It's not. There's no limit. I mean, we use technology, right? We have a robot out there that you guys saw. We of course use computers to fill our prescriptions, but in general, it's not a tech business.
Right.
It's a healthcare business. If we can find a way to make it a tech business, I think we could really expand our reach, expand our recognition,
sure.
And build something that is, next level.
That's super interesting though, because I want to talk a bit about you. I think what makes you unique from listening to your story is the service that you actually provide of the deliveries and kind of caring for these patients, other than just being a normal pharmacy, for lack of a better term. But if you don't mind me asking, what is the cost of that? Because you had mentioned earlier, as we were talking about how, your insurance, you might have to eat some costs because of, the copay, this and that, but you also have this added cost of like the delivery, and like, do you charge for that? How are you making up for those costs?
Yeah. So, and again, so you're right. So there is, we don't charge for our delivery. It's an all-inclusive, when you get our services here, we don't charge. There's no extra charges here that you would get if you just go to CVS. But I'm giving you the pretty packaging, the Medicaid, the maps.
I feel like we're doing
the home delivery. So our play at the time was volume. So like if we were significantly smaller than what we are today, I probably could not provide all the services that I provide. There's a critical volume in there that you have to reach that kind of allows, economies of scale, so to speak, that allows me to, do these services at an add-on. Plus, if I was charging people if I said it was $10 a month for the package and $10 a month for the delivery, no one's going to come with me. We talked about my population. They're sort of elderly and low income. They're not paying $20 for my services. But again, we were able to, parlay the volume of the amount of patients that we have, that the numbers still work, right? And then we're able to, again, economies of scale come into play. I can buy my drugs at a better price because I'm buying so much. Same with everything else. I mean, we buy our own cars. Everything is an economies of scale in this business. Everything is cheaper. Computers are cheaper. We just had we had a call yesterday. We'd like to use AI for some of our services, right? And let automation do them. And it's an economies of scale thing too. You pay, that you pay so much per minute, but once you do so many minutes, you get a lesser price, and so many minutes again, you get a lesser price again. So, and we're busy enough here that we could probably start at that decent rate tier right off the bat. So economies of scale make it practical.
Right. That's awesome. And actually, that's a good lead-in because, Shawn, I'll let you lead in with that question because you had a question about the AI stuff.
Well, so, I started thinking about, what I saw in there for one thing. And I know Antonino and I both in our businesses, we apply AI pretty much every day from creative writing aspect clear down to development, writing code, things like that would, require hours of time for somebody to sit down and do this versus applying it. What are you doing now with AI? I see from efficiencies, and you talk about scalability.
So I mean, here's my problem. I'm still a blue collar pharmacist in my mind. So I don't think like these younger guys do. And Shawn, you're ahead of the game if you are. I don't know what I can AI. So we had our initial conversation with somebody to kind of go through our workflow so they can identify things that we can AI. Because there are things that are, AI-able, for lack of a better term. There are things that are AI-able that I would have never thought were. For example, well, let's put it this way. The one part that I did know that I told you up there what we do a week or so before we're going to deliver to a patient's medications, we start making calls and we ask them a series of questions. Well, that is very easily can be handled by AI. And what that gives me is we spend so much time with patients not answering the phones and calling somebody maybe 3, 4, or 5 times before we get a hold of them, that I can just AI that phone call, then call 1,000 times, and it doesn't cost anything until that person answers. Whereas every time we call a patient 5 times, that takes 20 minutes of my staff's time, to do that. And we may never even get a hold of the person. That AI can keep going, and we discussed setting it up so we'll make like 5 attempts, and then if that doesn't work, it'll automatically switch to a text message to the patient. And we'll try to ask the questions, your delivery's next week, have you been to the doctor, is there anything we need to know? We can ask all those questions, via text message, right, or an AI, chatbot or whatever you call that in the space. So, but there were so many other things that we can AI. Like one of the biggest calls we get is people call here and say, hey, my delivery's coming today. Do you know what time? Well, it's hard for us to know what time, but as we all know from technology today, if if you order something from Amazon or whatever, you're practically following the driver stop to stop. Now, because we have drugs, we don't necessarily want to give somebody a stop by stop, to follow. Oh, like
Sure.
we don't want to give one of our customers access to where our delivery driver is, because who knows how many drugs and what those drugs are, in the car. So that we don't want to do. But that doesn't mean that they can't call here and then AI can look at our delivery software and suggest or tell them where that driver is in the process. And that would be AI. Right now, we have a person do it, but AI could just look in there and say that you're stop 20 and our driver's on stop 15. You
remind me of something. This isn't a sales pitch either, but that's the kind of work that ATSAP, Antonino's team, they do.
Oh yeah.
Yeah. So I'll give you another example of how, we've used pieces of this stuff. There's another client that we have that digital mapping was real important to them based on their service areas.
Right.
And they get a lot of phone calls, people saying, hey, do you service this area? And a lot of phone engagement, things like that, saving a crap load of time.
I know.
Now,
That's what
we can plug in an address and tell them what areas their pickups would be, drop-offs, things like that. So there's a lot of really cool ways to use that will help you for sure continue to scale this business.
Well, we're even going to see, and we have to check with the health plans on this, because I told you that we have the health plans actually pay us to educate somebody on diabetes. Yeah. It's a 10-minute call. Yeah. So would they care if we AI'd it? They may want it to be in person, so we haven't really done that dance with them yet. But I could AI that conversation. I could AI the whole conversation of the education piece and, then turn around and build a health plan and get paid that and really done it via AI. Yep. Now, I don't know if they want that or what my options are there, but it can be. That's that's an AI-able. Did I make that word up? Is that a good word?
I like that word. We're going to run
I want credit for that. If you guys use it, make sure I get credit.
Yeah,
there you go.
It's AI-able, right? That's AI-able, though. Yeah. That question, that education piece is AI-able.
And I think that's super interesting, too, because my beliefs is kind of on this conversation. You had mentioned the expense of a pharmacist. Pharmacists are expensive, so you don't want them going out and doing, for lack of a better term, mundane jobs. In my industry, too, programmers are expensive. And I believe that with AI and technology and more things becoming more efficient, that the large businesses of the future are going to be smaller, and not maybe in terms of scale or reach, but in terms of people. So, you might not need to have 10,000 employees to get a job done. You might only need to have 200, but 200 well-paid, well-skilled.
No doubt. No doubt. I mean, that's what AI, you can get into the proverbial battle of, what happens to all those jobs. But, times change and people need to change. Certain jobs, if a job is AI-able, then there's going to be another job that comes out of that. Somebody has to fix the AI,
100%
right?
agree.
Right? I mean, there has to be technology and networking and, programmers and all that stuff those are the jobs. So that's where you have to go to get the jobs.
Innovate or die.
Yeah, that's going to happen. I mean, there's no doubt. I mean, that's where it's going to happen. I mean, we have to get our country back to, the trades. I mean, there's no trades out. You have to change with what times bring you. And these people that get stuck in their ways, they're not successful. They're not the entrepreneurs. Right. They're not going to be on this show. Right. Because they don't have the balls to make the change.
Exactly.
Change is brutal, man. Change is brutal.
Change is brutal. Risk is brutal. It's not easy kind of taking that leap in, especially in, in an industry where, there are large competitors. So I admire what you did.
Yeah, I appreciate that field. It's a very blue collar industry still at the end of the day, right? It's not, pharmacy isn't sexy, right? You're filling prescriptions, putting them in a bottle. The people are sick. It's like being a doctor. There's not anything real attractive about it, but it's blue collar. But it's the ancillary technologies that we can apply, right? Like one thing, again, this is another reason why, I know I keep talking about myself, I'm sorry, but that's a problem.
That's the point of the show.
Ask my wife, she'll tell you. I have no problem talking about myself. But one of the reasons why I use delivery drivers is because my goal, my fantasy, is that a health plan will pay me per month to help them manage their patients, right? So, for example, I have 1,000 UPMC patients. If UPMC gave me $50 a month to help me manage them, that's a drop in the bucket compared to what this population costs them every month. If they go to the emergency room one time, it costs them $5,000. I'm asking for $50 a month. But that gives me, and now I have 1,000 patients. Now I have $50,000. What I can do for those people with that amount of money, is phenomenal. And I can, babysit them. I can really hold their hand. I can help, we can provide these and the whole nother level of services. But, this is why I use my delivery drivers though, so they can be eyes on these people.
Yeah.
But if I could send a driver to a house to do a televisit, right? So now we're bringing technology in. This 75-year-old, young lady from Homewood probably doesn't even have an iPad. But if my driver brings an iPad and can connect her to her doctor, now I can facilitate that doctor's visit. So, I'm combining, my delivery people and technology, but now I'm solving that problem. This lady needs a doctor's appointment. She'll do it right on my iPad. We'll facilitate it. And not only that, we'll set it up so the notes, we'll do the AI note thing that comes up on these televisits, and then we'll send it to a loved one or a caregiver or her physician or her other doctors, right? If she has specialists or her home care team, we'll send them that documented visit. But we facilitated that.
Yeah.
I just need a model where they're willing to pay me to do that.
Well, think of what you would save them too. If say just use that number 50,000, that wouldn't even cover the salary for one employee trying to do this stuff.
Exactly.
So if they source that, you're an extension of their resources, and everybody wins. It's a better service model for the patient, right? It doesn't put them in an uncomfortable spot trying to learn technology. Go back to my mom's example. My mom's not an iPad person, but she needs care.
But if that person pops in there, right, if my team brings their medicine and then coordinates a visit with their physician at the same time, I mean, it's a win-win. It's a win-win.
The insurance company will love you for that.
They will. We're trying. They don't yet. They don't love me. Can you come to the meeting with me?
We'll
remind them how they're supposed to love me.
Yeah.
That's cool.
Two bald guys come in, look like they're ready to strangle them. They'll
they'll
think
kick
they're
us
fucked
right
up.
out.
They'll go running out of the office. They'll be like,
past
these guys are going to kill me. These guys are here to kill. We look more like hitmen than pharmacists coming in there.
They won't let us pass the
You throw in my
receptionist.
Italian name, I just sit down. You guys walk.
Yeah,
in.
and he's Italian. I'm Italian too. My
There you
mom's
go.
half. I'm an Irish guy, but I'm
love
an
that.
Irish by like my nature and all. But my mom is. I am half Italian on my mom's
That's
side.
fantastic.
This is a great interview.
Yeah,
This is this is not what I was expecting. Not that you have all these
I
crazy
appreciate that.
expectations.
I guess I appreciate that.
That's a good thing. I think it's a good thing. It was fun, like I said, bumping into one of your employees out front just for casually for 1 second. And I love when you talk to people that are real people. And
Sure,
I
appreciate that.
You got good people here. You need to
I'm
be
very proud
of
of my team. But listen, it worked hard, man. You guys know the stories. You hear the horror stories, and this is true in the pharmacy profession as well. It's brutal finding reliable people. It just is. And we're lucky now. Today we have a great team. Tomorrow if I have to replace somebody or hire somebody new, it may take a while to massage that into something, the person that we want. But today we've been able to, make that work with the team we have. I mean, I'm very proud of these guys. I mean, they all work hard. They're all committed. They all help each other out. Mm-hmm. That's valuable too. Like neighbor helping neighbor, like it's, we have an old school mentality here. And then we're just trying to bring in new age stuff and marry it with an old school mentality of service levels.
Well, you figure too, you talk about your drivers a few times now, and you think, they're actually your eyes out in the
That's
street.
what we tell them all the time.
And they're helping people. So, that's care that you can't really teach. I think it's through the hiring process when you're bringing people on, if they're wired that way. Some people are compassionate, some aren't. So I'm just going to throw this, delivery people would throw it out there, and these people were actually engaging.
Yeah, and it took a while to find them, though. You're
It's a
right,
big deal.
because everybody's not wired. I like the way that you said that, like the wiring thing, because I've used that analogy myself. Like, I'm just wired to do what I do. It's not, I don't give, like, a lot of times there's not a thought process in what I do. That's the way I'm wired, right? I mean, I do it, I help people. I take deliveries myself, If somebody needs something and our delivery drivers are already gone and something comes in here at, at 3:00 in the afternoon and somebody needs it, I'll take it. I don't mind one iota.
That's work ethic too, though. What did your parents do?
Yeah, well,
Just curious.
My mom is a rock star because, think about it. I told you my dad died when I was young, so my dad was in sales. My dad was very much like me from what I hear. I was 12 when he passed away. So, I knew enough about it. I knew some about him, but not his adult life because, I didn't see that I saw my dad, not an adult. But my dad was apparently very much like me, and I'm very grateful because I turned out okay. But my mom was a rock star because she turned around and raised 3 kids, 3 boys, with, she taught in a Catholic school, so that it wasn't even very, very expensive. It wasn't a huge income job, and she managed to raise 3 boys. We all went to school. We all have great families. So
Could
she
you
was
imagine
really
what challenge she was?
She was really a big part of I was the worst of the 3. My youngest brother actually works here, and he was a bad seed too. But my middle one, he's a teacher of all people, and he's the one he never got in any trouble. He was the clean one. So he says. I just think he never got caught. There's a difference between, you're not really doing something bad if you don't get caught, or are you, right?
They say the oldest child makes all the mistakes so the younger ones can learn from them.
That could be. Yeah. Well, by the time you get to the youngest, your parents are just fried.
They don't care.
You do whatever the hell you want. My wife is the youngest of 3 girls.
Yeah.
She was like, I got away with everything because by that point, my parents were fried.
Yeah.
They just couldn't take it anymore. They were like, just go out there and, don't hurt yourself, don't hurt anybody else. And other than that, you can do whatever you want.
There you go.
Well, we're just throwing stuff out. How did we find this guy?
Jaden
tried to sell me Bitcoin like a couple years ago. The fucking thing I didn't listen to. No, honestly, Bitcoin's probably quadrupled from the time that he and I met. I mean, it was probably, it's probably quadrupled from the time that we met. But at the time, it was even more. Yeah, I gave you props. But, at the time, Bitcoin was, even today, there's so many people that are reserved about it, right? So some people believe in it, some people don't in crypto, the opportunity, but, I have like FOMO, so I don't want to miss it. So I'm like, I got to get in on this because if, Bitcoin or XRP or one of these things, comes out of the gate and, makes more millionaires than it already has, I want a piece of that.
Sure.
Yeah.
So I'm in it. I don't even understand it that much, but I don't want to miss it either. My wife will tell you, I have FOMO, so I'm afraid to miss anything. Like if somebody's going somewhere, I'm like, yeah, I'll go. What if something happens? What if it's the greatest time of somebody's life?
Hey.
I want to tell the story, not hear the story.
True.
Yeah.
So that's why I try to, so that's why I'm in Bitcoin.
That's a great tattoo, actually.
FOMO.
No. I want to tell the story, not hear the story.
There you go.
That's cool.
I think that's what entrepreneurs do, though. They want to tell the story. They don't want to hear the story.
That's why. And I keep talking about my wife. My wife, of course, is a rock star too. But we realized over the past, we do a lot of concerts and we're fortunate to travel and do all the fun stuff. We never take pictures because we're stuck we're living it. Mm-hmm. So the pictures are in my memory. And when that goes, the stories and the memories may go, but we're not caught up in taking pictures. Nothing. I don't want to say irritates me because I can give a fuck. But like people at a concert when they're just sitting around videotaping the whole I'm like, you're not even. He's singing up there and dancing around, and you're worried about taping. You're never going to watch that. Mm-hmm. You're never going to watch that.
You paid to be there.
Yeah, enjoy it. Dance with your girlfriend or whoever you came with, or do some shots and sing a song, sing along. Don't get caught up in video, isn't it?
Right.
It's frustrating, but again, that's generations. Again, things change, and there's a new day and age.
100%.
You want to hit him up for that one word?
Yeah, Shawn, we really appreciate you coming on and sharing your story. It's been great. It's been great to know. It's been great to get to know you. But before we wrap up, we always ask all our guests one question.
You don't fucking tell me this. So this is it, spur of the moment.
It's spur of the moment.
I didn't get any hints on this. Is that what you're saying?
Yeah, no, it's off the cuff. If you can give one word of advice to a young entrepreneur or someone who wants to start a business, what would that be?
Hustle.
I like that. Hustle. That's pretty good.
You have to hustle every day.
Every day I'm hustling.
Or Rick Ross.
You'd be a great, I think, podcast voice and podcast like host.
Well, let's do this again. Let's come up with a different topic or something.
Yeah,
like that.
I'm down for that.
Maybe we can talk about maybe not. Maybe we can get into like true pharmacy stuff, like things that matter in pharmacy. Or even though you're not a healthcare podcast, we'll come up with something. I'll do it again.
Love to learn more about it. Yeah.
We'll go down to Duquesne Club down there. I just don't dress appropriatly for how the fuck you Hucklebucks get into Duquesne Club dressed like this?
I don't know how they let me in.
I was going to say, you can't get into the Duquesne Club dressed like a Hucklebuck. I mean, how's that happen?
You remember how I used to dress back in the day?
Yeah, I do.
I would love to see Jaden in this suit.
I used to wear it all the time.
Really?
Dude, he did. He was a stockbroker. That's what I was sold as. It was like, oh, I'm a stockbroker, man. gravitating towards crypto. It's the future. Crypto's the future. I still can't buy anything with crypto, but yet I own a bunch of crypto.
Yeah, I know. It's going to take some time.
But you know what? I can't buy anything with my stocks either, right? You have to sell them and get
Right.
money for it. So that's what I tell people. It's the same concept.
You
It
got
is.
money on
That's all it
paper.
is.
Sure.
That's all it is.
Good.
Sean, thank you again. We really appreciate your time.
Yeah, I
and thank
appreciate you
for sharing
guys
your
coming out,
story.
man. I really enjoyed it.
This was a good one. I
Jaden,
loved it.
thanks for hooking us up.
Yeah.
It was a good time. You guys were doing good stuff. I appreciate the work.